Portman of Ohio joins us on that. What do you think of this, Senator? Yet another stimulus measure, relief measure, whatever you want to call it, and maybe a big one.
Well, Neil, let's see how this one works. $2.3 trillion is a lot of money. we have spent through this one CARES package, which was necessary, absolutely necessary, more than we annually appropriate in Congress. So, when you include the mandatory side, of course, it's more than that. It's $4.5 trillion. But, this alone is equivalent to about what we spend every year. So let's see how this works. I do think that the next package should be one where we close some of the gaps that we have found that was not appropriately distributed in this one. As an example, hospitals. In Ohio, we're really hurting right now. I don't know if there'll be enough in here to cover some of the deep concerns we have, particularly with our rural hospitals. Their revenues are way down, obviously, and their expenses are up. But then second, I think we ought to look, I hope, beyond the crisis. By then, one would hope that we begin to see us flattening the curve, begin to see us coming on the other side of that curve, and so talking more about stimulus. And you're right. That typically is tax relief and things like infrastructure spending. So my hope is that on the rescue side, we'll be able to close some gaps that were not fully anticipated through this first legislation, the Phase 3 legislation, which was the legislation was just passed a week ago. And then second, that we look forward and say, how do you get this economy really humming again?
Then where did Nancy Pelosi draw the distinction, Senator, between those prior measures you alluded to and her saying next time we have to focus on recovery? Did she mean after all of those take effect and there's still work to be done to pour money into that? Do you know what she's talking about?
I'm not sure. I mean, I think, first of all, what she wanted to do was to add a lot to this legislation that was just passed, the CARES legislation that had nothing to do with the coronavirus per se. It was in part a wish list, as you know, and in part things that related to stimulus that you would want to do, once the health crisis is behind us. Because right now, as long as you have the crisis in effect, you're going to have the economic fallout that we've seen. When you see the crisis, the health crisis be addressed, when we begin to see some better numbers, when we begin to see, fewer, not more cases day to day, that's the time to start looking at, well, how do we now stimulate the economy? People aren't able to make things, so there's not going to be products out there for the consumer to buy. Consumers aren't going to go to restaurants. They're going to go to retail establishments. We aren't going to go back to work and back to school until the crisis is abated. And that's when you look, I think, to these stimulative initiatives like the tax cuts that we did a few years ago, which were very helpful, and also with the some of the spending provisions like stimulus that you talked about with infrastructure, where you can actually do something that's both stimulative in terms of creating more jobs and activity, but also good for the economy in the mid and long term.
Senator, a lot of people want to see a V or U-shaped recovery where you just dash out of this thing. And I'm wondering, this is more psychological than anything else, how is that going to happen even when we do get things right with the economy? I have no doubt we will. It was strong before. It will be booming back. I have no doubt. But a lot of people are going to be leery of flying for a while. They're going to be leery of going, in tight places with people for a while. Like John Taffer, the American Bar Rescue host, who was saying he thinks restaurants are going to have to spread out a little bit more, the seating capacity. Wouldn't be surprised if he saw it in stadiums and sporting events. It's going to change the way we are. It's going to change people's vacation plans and all of that. So I guess what I'm saying, given all of that, the psychology might not be there for a boom back. What do you make of that?
Well, the president talks about pent-up demand, and I think he's right about that. I think there is going to be a pent-up demand to get back to our jobs and back to working hard and higher productivity and so on. But I also agree with what you're saying is it will be a different economy, at least for some time. I think people will be more hesitant. There'll be more social distancing, as we say, and there probably should be, because once we get this first wave of the healthcare crisis behind us, it's possible there could be another one. I talked to some experts today that are talking about, the possibility that as the weather gets cold again, we might have a resurgence of this. So we have to be careful. So I think there will be a little different approach. One thing that I think is very interesting, and it doesn't necessarily relate to a slower growth, but a different kind of economy, is the amount of teleworking we're doing now. I have friends who are and I guess I'm one of them, working hard at home, 12 hours a day, some folks, and being actually pretty darn productive. So I think we're learning more about what we can do without
Absolutely.
being in an office setting. That isn't necessarily a bad thing. That could actually lead to not necessarily a better or worse economy, just a different economy.
By the way, it doesn't work for everyone, Senator. Teenage boys, for example, I found that's a bit of a challenge. So I'll keep you posted on that. Senator, thank you very much, and thank you for all you've been doing.
Neil, thank you.
Both parties really doing yeoman's work.
Thanks for your thoughtful approach to this.
Thank you very much, Senator. All right, the Senate was touching on this